大家好，我是郭志，我现在在纽约。最近很多方式希望我可以采访到 Lipkin 教授。Lipkin 教授是全美国最厉害的 virus 专家之一，他是哥伦比亚大学的 Melbourne School of Public Health 教授。那这个疫情发生的时候，他第一时间就去中国去见钟南山院士，然后他上个星期回纽约，在家里2个星期隔离。所以我没办法采访到他，但是今天我采访到他的同事，也是一个哥大的 Melbourne School of Public Health 的教授，那他叫 Professor Wafa El-Sadar. Professor Wafa El-Sadar 是 the Director of ICAP at Columbia University and Director of the Global Health Initiative at the Melbourne School of Public Health.
Now, it is unclear if there's any medication that specifically can work against this virus. The good news is we know the virus very well, so there are people who are now screening a lot of medications. They're screening whatever's on the shelf of medications to see is it going to be effective against this virus. So hopefully within days, if not weeks, we'll have a hint of what works. We don't know yet of any specificity against any specific drug that works against this virus. I think people are working very hard, both in China, and that's where the science and elsewhere, they're taking essentially drugs that are on the shelf that work for other viruses and testing them in a test tube to see if they will work. We may have the answer by tomorrow, we may have by the next day or the following day, but it's an ongoing, and lots of people are doing that now. So in this situation where there's so much uncertainty, people have been thinking that trying like some anti-HIV medicines or some anti-Ebola medications. There's no evidence as of yet that this works. Really most of what's done now is supportive treatment, which is very important. Supportive treatment meaning if people have a high fever, to give them medicines to bring the fever down. If they have trouble breathing, to give them oxygen to breathe, for example, or if they need to be on a machine, a respirator to help them breathe. If they're dehydrated because of high fever, then to give them fluids, either fluids by mouth or fluids by an intravenous. So supportive treatment is very, very important. Most of the cases are not severe. About 10% of people, according to what we know today, about 10% of people who get coronavirus infection have severe disease. But 90% don't have severe disease. And in those individuals, probably these kind of supportive measures they're gonna recover. And once they recover, they'll do fine. I think the people with severe disease are the ones that there's concern about, obviously. Those are the ones that need intravenous fluids, they need to be in a hospital, they need to be maybe on a respirator, they can't breathe on their own. Those are the people who are really in dire need of sophisticated care. What you need to do is to develop protection. How can you develop protective antibodies or these molecules in the bloodstream that can then fight this virus? And if you have evidence that you've been able to develop that in the laboratory, then you can manufacture these molecules into a vaccine. But that's a long process because then you have to take whatever you produced and then you have to test that first in a number of people to make sure it's safe. So that needs to be done. And then once you've shown that it's safe, then you have to also then demonstrate that it's effective, which usually it's a larger study at that point in time. So from day one to getting an effective vaccine, it does take time, and probably people are saying it's going to be at least a year. Well, there are a lot of reasons. One is the issue of whether the virus is sensitive to temperature or not, but then the other issue is that, of course, in the winter time, we congregate together more, right? So I think that's part of it. Is that in the winter there's usually much more indoors, indoors and congregation of people indoors much more than in the summertime when we're outdoors, there's much less people-to-people contact. So that's also part of it as well. I think the hope is that we will see the same thing happen as what happened with SARS. There's similar viruses. The same thing people have said that hopefully also, we look at the curve of what's happening with numbers of new cases, right? And so that's the curve we watch very carefully. What you want to start to see is a plateauing of numbers of new cases and hopefully a decrease in number of new cases. We haven't reached that point yet. It's estimated that every person who has coronavirus is infecting about 2 people. And you want it to go down to less than 1.
Yeah.
That's what you want, is less than 1. More awareness, more early diagnosis, so you can actually then don't be in contact with more people, right? So more awareness, early diagnosis are very important. And then some of these containment, trying to have people self-isolate themselves if they have the virus, so they're not transmitting to others. That can also happen.
我想让大家知道，在你们看不到的地方，我们专家、教授、医生，还有护士，还有很多人，都一直努力的战斗。我希望大家不要恐慌，做好防护，一起加油。那我现在走吧，拜拜。我是郭杰瑞。